and the physical and mental toll has become overwhelming for those on the front lines fighting to save lives. Many doctors and nurses now becoming infected themselves or working with fear of getting sick. Stephanie Gosk has that.
In flooded hospitals, our healthcare workers are treating patients and bearing witness.
Just got done with a long and hard shift. A lot of sick people on vents, running out of room and vents.
They come in droves and they're sick.
You'll see a packed waiting room, people packed in like sardines, 30 to 40 patients outside, coughing on one another, spreading COVID-19 to one another.
In the last few weeks, Dr. Calvin Sun, an emergency room doctor, has worked in a dozen New York City hospitals, over 18 shifts.
Now we're bursting at the seams, and it just seems that the system is about to collapse.
The strain on the system is being felt all over, from New York to Georgia to Michigan.
I had a breakdown yesterday morning because I am not able to mentally wrap my head around this, even though I'm in the front line.
We pull them inside from the car line and, they're okay 1 minute, and the next minute, you're preparing for another intubation.
Each shift unpredictable and taxing.
I've had a lot of my providers and their shifts in tears. It's more than any of us signed up for.
I quit my job today.
Chicago nurse Imaris Vera says there were so few supplies at her hospital, she no longer felt she could protect herself.
I have family that I have to come home to, and the way things are looking, this isn't going to get any better. America is not prepared, and nurses are not being protected.
It just feels like we're just kind of being thrown out into the wild.
Thomas Riley is a registered nurse in the Bronx, now a recovering COVID-19 patient. One of more than 200 health workers in New York City who have tested positive, with lingering questions about safety gear.
When push comes to shove, I'm putting my life on the line to help patients out, and you have to tell me if I'm not going to get the proper gear.
I've been treating my own colleagues as patients. I've intubated my own nurses.
Often when it's time to lean on someone, they rely on the colleague at their side.
The message that we are sending to each other is that we are here for each other. We are here for our patients.
It's scary every day, but every day we just try to love bigger and care bigger and keep pushing forward because that's what we do.
And we are all thankful that they do it. Stephanie Gosk, NBC News, New York.